I mean, would you want to remove your teeth at night? There's a lot of differences between fixed and removable implants when it comes to daily life, and that's really one of the biggest ones. Usually, when someone is able to do the treatment where they're able to do the fixed teeth, that's just so much more advantageous. It feels like your natural teeth. You're brushing them, you're utilizing them, they feel natural. And so there's big differences between that and something that has the ability to come in and out. It's still much better quality of life to have dentures that snap in and are able to be secured by those implants. But there's also a big jump between the ability to have teeth that are fixated on those implants that don't come out. Those materials are different. They're much more wear resistant, stain resistant, and feels really nice to be able to go to bed and not have to take those out. Not everyone wants fixed teeth. Here's why snap-in dentures make sense for some people. Usually, more often than not, people would love to have something that's fixated and that does not come in and out. That may not always be an option for some. Some people might be in a situation where they've been wearing dentures for decades or for a very long time, and they've been unable to carry on a good quality of life with that. But they have been able to come to a point in life where they're able to invest in something that's going to improve their quality of life. And so that's where I feel like a snap-in option is a great improvement from something that's in their gums, just loose, and they now have the ability to get that support and be able to chew different foods and not feel like their teeth are moving all over the place. Your grandparents' dentures are not what we're talking about. There's a big difference between wearing traditional dentures and wearing the snap-in dentures. So you might have seen in some movies, you might have some family members that have had to wear dentures in the traditional sense where it's an acrylic and there's pink on it and there's teeth on it. And a lot of times they're having to use glue to help keep them in. And that's very different than some of these other options. For example, we're able now to have implants support those dentures. And that is a great option for patients who want the ability to have the security, have teeth that are more secure and stay in place better. Allow them to chew foods a little bit better than trying to chew with teeth that move all over the place. It gives them a lot more confidence too. They don't feel like if they smile big or if they're laughing big and in a social environment that the teeth are going to come flying out. So it's a really nice option in a lot of ways. So they're able to eat things better now and they're able to socialize a lot more confidently as well. The difference between a jaw that has implants versus one that doesn't have implants over time can be significant. So when we have our teeth in our jaw, those teeth stimulate the bone internally, and so it keeps your shape, your anatomy, it keeps your bone from atrophying. And so over time, without those teeth in place, you might have noticed, you may have even seen a movie where someone takes their dentures out, their whole lower third of the face sort of sinks in and it doesn't look great. But that's what happens when there's nothing stimulating that bone. The denture actually can accelerate it. But when you have implants, whether it's to support your dentures or whether you have implants to support a fixed option like a fixed arch of zirconia in there, those implants have the ability to stimulate the bone. And as you age over time, it maintains your facial structure. So it keeps you looking young, keeps you looking healthy, and it allows you to function really well too. So it's a great option. Yeah, a patient can always start with snap-in dentures and upgrade later to fixed full arch. It really just depends on the situation. So if you're a patient who is able to have 4 implants in the lower jaw or 4 implants in the upper jaw, typically we plan those cases to where it gives the patient the option down the road to be able to upgrade. The only things that changes are the implants themselves, they don't change, but the things that do change are the components that attach the implants to your teeth, and the teeth themselves are completely different materials. So it goes from the snap-in, where it's snapping into acrylic dentures, to the fixed zirconia, which is something that's screwed into the implants and is much more resistant and resilient. It's a much firmer material, feels a lot like ceramic, and so it gives the sensation of natural teeth. This is the one question I ask every patient before they decide between implants and dentures. What brought you here today? Like, what happened in your life? What event has caused you to say, okay, this is it. This is the time for me to do something. And I see this almost with every patient who comes in with terminal dentition. They've either been caring for somebody, they've either been really busy with work and life just gets in the way. And these things, they don't happen all at once. They happen over time. And so I always like to ask, so what is it? And usually they'll point to an event Or they'll point to a situation where I was playing with my grandkid and they're like, Grandpa, what's wrong with your teeth? Why do they look like that? And so it makes them, want to change. And that's always what I want to get to is the why. And a lot of times people don't think about it until it's been a long time of things breaking down and they've been putting up with the pain or the infection. And that really helps us try to come up with a solution for the patient. The $10,000 question, here's what you're really investing in. A lot of people want to know what really is the difference between snap-in dentures to fixed implant zirconia. And what I like to talk about is something called lifetime value. So one has a lower entry cost. For example, the snap-in dentures. You're going to get implants, you're going to get a set of teeth that snap into those implants. And the other one is also implants. The components are different and it's fixated into your jaw. You don't take those out, only your dentist can. But what I tell the patient is, are you the type of person who wants to do something once and be done with it? And that's where if someone says yes and they have the means and the ability to invest, that is the option that I most always recommend. Sometimes not everybody is able to get to that point from an investment level. And like I said before, we can always start here with the snaps and we can always upgrade later down the road. But what you're really investing in is something that you won't have to keep spending money on. One of the things about snap-in dentures is there's a lot more maintenance involved. Those teeth, they're made out of acrylic. So they don't last decades like a fixed zirconia would. A lot of times you may only get 5 to 7 years out of those dentures and then you're having to make new dentures over and over again. And so over the course of a lifetime, the cost can sometimes pass the cost of what the zirconia would have been on the front end. So a lot of times I just point patients to the lifetime investment value. They come out to be about the same. It just matters about what you feel like you want to do. If you're able to spend more now, but be done and not have to worry about, or if you want to just spend a little at a time. And that's really the ultimate difference. Here's what surprised patients most about their new smile. They've become somebody who just smiles and are happier much more often. I hear this literally all the time. Last week, we just had a dad who just got his teeth done and his son came in and he's like, the son told us, I've never seen him smile this much. It's almost like they've had to cover up who they really are and, you be embarrassed and be ashamed, and it's affected their confidence in their day to day. And now that you've given them something to be really proud of, it's almost like their personality just becomes a lot more brighter. So that's one of the things that I hear most often is patients are so much more confident in their ability to show their personality now.